You're all right. It's all right, Heather. It's okay. It's okay.
Tendency towards thermodynamic disorder.
Entropy.
It appears to have been sound judgment to have called me in, my boy.
Painter of the birth of Venus.
Botticelli.
The presence of adhesions in such abundance necessitate a somewhat unorthodox technique.
Caused a boom on 14th of October 1947.
Jaeger.
Could have done that in my sleep.
Yes, scissors. The modified cross-hand Warrender technique. Not a commonplace procedure by any means.
Need a new bulb there, Doc. Looks like Fred was right. I'll get this into the supervisor.
So where were you taught the modified Warrender, Mr. Doherty?
Borneo, 1961. No one told me. I invented it.
Who's for a brew?
Oh, not for me, thanks. I've got to be on my,
No,
thingy.
Mr. D, thanks.
1961, eh? Times have changed. Perhaps some of us haven't changed with them sufficiently to be of much use anymore.
Night, Mr. Doherty.
Who's had a mad crush on Mary Ellen? She was the bike of the Mormons. Oh, no, I've got to let my keys inside. Use Roger's room.
Night, John boy.
Night, Mary Ellen.
Heather? Heather, can you hear me?
Her neurowobs have been dropping off steadily since she came up.
Dex, CT to exclude cerebral abscess. There's an argument for ceftriaxone.
Yeah. Dr. Collin. Alison. No, I thought it was going to be another bloody GP. What? Yes, I'm sure they do a very difficult job, but...
You don't know who Andrew's married to, do you?
First Christian mass who said yes.
Alison, I can't speak to you right now. Well, I've got a very sick patient. Yeah, well, I'm sorry too, but I've got to go. Dr. Turner, thanks for coming in.
Please, do your tie, put on your white coat. We should appear professional, whatever the hour.
Yes, absolutely.
Her CSF's crawling with polymorphs and gram-negative cocci.
No realistic doubt about the diagnosis. We're attempting to control the seizures with IV phenytoin.
Start her on an intravenous dexamethasone, 4 milligrams TDS. I'd like to have a CT scan as a matter of urgency. I should speak with her parents. Poor girl.
Hey! For all I know, the last girl you were with could have been a right dirty cow.
She was. It was you.
That was... You might combust. There'll be pieces of me coming off in the bath at once.
Hey!
Woo! Hey! What kind of peasant do you think I am?
Oh, wait till the three of us must have set it off.
My lips are sealed. I'm certain that her epileptic seizures are a result of the meningitis. Now, Heather is receiving all the right treatment, but I've ordered a brain scan to make sure that there's...
I'm afraid I've got some very bad news. Heather died on the way to the scanner.
Because of you! I knew it was serious, but you didn't listen! You've killed her!
Mr. Parsons, please.
You've killed her!
Jack? Jack?
It's the GP. It was the GP, Wilson. When I saw that girl in casualty, she only had flu-like symptoms. They rang up Wilson. Said that she'd got worse, much worse, said that she'd got a rash. He said, forget it!
Andrew, I advise you to be more circumspect with your invective.
Not speaking?
Not speaking.
Boys, please. Your mum.
Yes. Yes, I am off duty tonight. I'm sure she is, but I'm just not in the mood. Face it, Raj, you just can't pull birds. May as well let your mum arrange one for you. Sure, I had a mum who was always trying to fix me up with dusky beauties. I suppose it won't do any harm to meet her. Yeah, Mum, bye.
Raj, it'd be a real help if you cleared the small cubicles.
Action stations, Raj. That's what casualty's all about. It's probably only a sprain which will respond to rest, cold compress and painkillers. I can't say for certain it's not a fracture without an X-ray. Wasp. Or bee. So how long have you had this? Of course it still hurts. The inevitable consequence of injury. It's probably only a sprain which will respond to rest, cold compress and painkillers. I can't say for certain it's not a fracture without an X-ray.
Thought you might want to study Heather Parsons' notes just in case they're in need of some buffing.
I don't think so.
I can guarantee you that's what Wilson's doing right now. Making it appear that the parents said the deterioration was negligible, that there was no meningococcal rash.
I told Dr. Turner about Wilson last night, all right?
Andrew, they play golf together, for God's sake. All consultants want to keep GPs sweet so that they'll refer them private patients. Turner had sit up and begged to Wilson if he thought it'd help him maintain one of the most lucrative private practices in the district.
Well, it's down to me then, isn't it?
I've seen Wilson at work myself. He does clinical assistant in casualty on Mondays. He's notorious for being a blundering oaf, but he gets away with it. He's been getting away with it for 20 years. Because he charms his patients. Any doctor daft enough to complain would be dragged through the courts until they were a pauper. The General Medical Council would only do something if he slipped his hand up someone's skirt.
I do weary of these weekends on take, but at least there's a month's respite until the next one.
Oh, I was going to ask you about that, Dr. T. Next Saturday is the semi-finals of the St Herald's Cup.
Oh, well, I don't think the first 15 ought to be deprived of its star number 8. I'm sure Andrew wouldn't mind holding the fort that afternoon, eh, Andrew? Oh, I regret to say, I forgot to reschedule my private patient's clinic today, so we'll have to resume later this afternoon. You might attend that seminar at lunchtime. You are here to learn, after all.
Well, let's hope we're learning about the mistakes we make when we're dog-tired, eh?
If junior doctors worked shorter hours, I fear their training would suffer. As if hard work ever killed anyone,
No one except the doctors who kill themselves because they're so stressed out.
Are you going to talk to me? Your hospital manager's living it up in Paris. His deputies have never even heard of my daughter.
Please calm down, sir. I can assure you that we're doing...
I want to see him made to pay for what happened to my daughter.
No, but I really mean that we can have...
I want to see him made to pay.
I said I'd meet her. I never said I'd marry her. Yeah, you do that, Mum. Bye. This is it. This is your big chance. The girl croaks with meningitis, who you've seen, but it's Andrew who carries the can.